the basic premise for anything in survivorship is based on the idea that now there are so many more survivors of childhood cancer, and with that came the capacity to understand that the treatments that we use actually cause long-term complications. And included in that are effects on fertility, which are extremely important to survivors. In fact, in many instances, they indicate that it's one of their primary concerns. And there are two forms of the impact on fertility. One is what we call acute ovarian failure, so something that really happens right after the completion of therapy. But much more common among childhood cancer survivors is premature menopause, meaning that if you hadn't had cancer, maybe you would have gone into menopause at the age of 50, but now it's likely that you'll go into menopause much earlier. And the implications for that are obviously when and if you're able to have a child, which is very important to survivors. And so the most important thing is trying to understand who really is at risk for this, and can we actually make some kind of recommendations that are meaningful about when you should either attempt a pregnancy or attempt fertility preservation procedures so that you can have a child. Because what is almost impossible to predict is when an individual person is actually going to go into menopause.